Hi everyone, I am Dr. Sibashish Day. I work as Clinical Affairs Head for ResMed, and every day possibly we deal with patients who are having either sleep disorders or are having COPD or chronic obstructive pulmonary disease in some form or the other. So today we will be discussing about chronic obstructive pulmonary disease. So this is a disease which happens in the lungs, and there is restriction of airflow in the lungs, due to which there is breathing difficulty in the patient. So if you look at this particular disease, the burden of this disease is quite high, and this disease is the third largest disease which leads to mortality across the world, right? So it's a grave disease, and typically when we look at patients, if we look at the causative agents, cigarette smoking, bidi smoking, these are the the causes which leads to COPD. But all said and done, both indoor and outdoor pollution also leads to COPD. For example, a lady who has been cooking on chulha for a long time is also prone to COPD. But at the same time, taking pollution apart, there are also certain other causes like alpha-1 antitrypsin deficiency, which is basically a genetic cause. There are causes which are related to childhood asthma, but the last two of the causes are lesser known causes or lesser appreciated causes. Well, from a larger aspect, both outdoor and indoor pollution and smoking is the largest cause of COPD, right? So what are the signs and symptoms? So there are different signs and symptoms, right? There is difficulty in breathing, there is chronic cough without sputum. Sometimes there might be also a bit of expectoration, and at the same time there are also other signs and symptoms like fatigue and also chronic weight loss, right? So these are the signs and symptoms. So how do we diagnose it? First of all, if you are having the symptoms and if you have a history of smoking, please visit your chest physician or pulmonologist, right? And at the same time, they would do different clinical examinations, and at the same time they would also do a spirometry test to determine whether you have a COPD, or rather they would determine what your lung function is. And at the same time, so what lies in the treatment? So if you look at the treatment, doctors typically go for bronchodilators, both short term, long acting and short acting bronchodilators. And at the same time, if someone is having an acute exacerbation, which typically happens in our country during the days when it is quite cold, when there is pollution outside, so typical of the northern part of our country. During those times, there are acute exacerbations which happens with COPD. So very often these patients are breathless along with fever, and then they get admitted into a hospital. So here also both bronchodilators, oxygen therapy, antibiotics, sometimes a bit of steroid, and sometimes in grave situation, non-invasive ventilation is provided to the patient. There are also different other classes of patient where the COPD have actually progressed to a long term or long duration COPD is there. So these are the patients who might not be able to breathe in normal oxygen, in the room oxygen, right? So for them, the oxygen saturation falls. So for them we have to provide long-term oxygen therapy, which basically providing oxygen to a patient via an oxygen concentrator or maybe through an oxygen cylinder. There are also a certain subset of patients who require ventilatory support also. So these are the patients whom we provide non-invasive ventilation, where the ventilation is given through a mask. And because of this ventilation, there are a lot of benefits. The oxygen saturation is maintained. These patients are less prone to exacerbation. The admission rates into the hospital is lower. The OPD visits are lower with non-invasive ventilation, right? So what I wanted to discuss with you is all about what COPD is, how do you get diagnosed, and what are the different treatment modalities. So please remember, if you are a smoker, if you are having signs and symptoms which I just told you, you may want to visit your physician and get diagnosed early, so that the progression can be arrested at the right time. So hope you enjoyed this video. Thank you for your patience.